government says it has outlined 6 critical strategies to reduce the risk factors associated with diabetes and non-communicable diseases in Nigeria. Minister of Health Isaac Adewale made this known at the official launch of the Base of Pyramid project in Lagos. We have details in this report.
About 1.5 million Nigerians live with diabetes, but only 4 out of 10 are diagnosed and 20% are receiving care. To break this trend, a global leader in diabetes care seeks to contribute to the Nigerian government and people living with diabetes. Minister of Health, who was represented by the Medical Director of the Federal Medical Center, Lagos, Dr. Adedamola Dada, said one of the reasons why diabetes remained a challenge in Nigeria is the low integration of diabetes screening into routine general health services.
To the tertiary institutions, that we should actually incorporate diabetes care. Okay, one of the major components of diabetes care is actually the health education. Okay, health education in diabetes is very important even before the diagnosis is made. It's important when the diagnosis is made. It's important during treatment. So the government has not in any way relaxed in this area. We continue to expand the frontiers, and we call on you, our friends in the press, to actually join us to get to as many Nigerians as possible.
The organizers of the event underscore what they intend to achieve with the project. On his part, the Danish ambassador to Nigeria, Torben Gattemann, advocated screening for people who are over 40.
This is part of our general work in terms of promoting the cooperation and the bilateral relations between our two countries. When it comes to specifics and in terms of what the private sector can do, and in today with the launch of the Base of Pyramid.
We also work on awareness, diagnosis, training programs, but in collaboration with the Diabetes Association, in collaboration with the government, in collaboration with the teaching hospitals and healthcare professionals, with associations like FHI. So we are in a very multifactorial, multi-collaboration approach here in Nigeria.
Experts at the event believe that providing greater access to populations living at the base of the pyramid not only contributes to improving lives, but also to enhance the chance of communities.
Now, if we talk about our traditional diets as in gari, amala, they are healthy. But once again, if you decide to take this to the extreme, it's too much of it. Because it's all about what you take in. There should be a balance with what goes in and energy expenditure. So if you're taking the traditional diet and you're doing a lot of it, you're still going to run into being obese, and that is a risk factor. So we preach moderation.
So the number are actually increasing, but it's not increasing proportionately to the number of people who are becoming diabetic in Nigeria. So there is a need for the government to expand the training centers, because these centers, not every center can train diabetologists. Only centers that are approved, and the government has to provide the training facilities that will be able to absorb more people who are interested in the training.
The Base of Pyramid project is an initiative that aims to increase access to comprehensive diabetes care and treatment for the working poor in developing countries.